Good day, I'm your student nurse Isabel de la Cruz from NUST, batch 2023. And for today's return demonstration, we will be performing providing tracheostomy care. The goal of this procedure is that the patient should exhibit a tracheostomy tube and site free from drainage, secretions, and skin irritation or breakdown. For the implementation, number 1, bring necessary equipment to the bedside stand or overbed table. Number 2, perform hand hygiene and put on PPE if indicated. Number 3, identify the patient. Number 4, close curtains around bed and close the door to the room if possible. Number 5, determine the need for tracheostomy care. Number 6, explain what are you going to do and the reason to the patient, even if the patient does not appear to be alert. Number 7, adjust bed to comfortable working position, usually elbow height of the caregiver, lower side rail closest to you. If the patient is conscious, place him or her in a semi-Fowler's position. If the patient is unconscious, place him or her in a lateral position facing you. Move the overbed table close to your work area and raise to waist height. Number 8, check for lung sounds. Number 9, place the towel below the trachea site, covering the neck and chest of the client. Number 10, put on face shield or goggles and mask. Suction tracheostomy if necessary. If tracheostomy has been suctioned, remove soiled site dressing and discard before removal of gloves used to perform suctioning. Number 11, prepare the basins and cleaning solution. Mix sterile water or plain NSS and H2O2 in one basin 50-50. Be sure it will fill 0.5 inch of the basin. Add another plain NSS in another basin that will fill at least half inch. Number 12, perform gloving. Cleaning the tracheostomy. Number 13, remove the oxygen source if one is present. Stabilize the outer cannula and face plate of the tracheostomy with your non-dominant hand. Grasp the locking mechanism of the inner cannula with your dominant hand. Press the tabs and release lock. Gently remove inner cannula and place in first basin with plain NSS and H2O2. Let it submerge there for a few minutes. Simultaneously, gently slide the trachea pad or dressing downward and discard. Check for some exudates or drainage, skin breakdown, irritation, and inflammation. Number 15, clean the inner cannula of the trachea tube using the prepared plain NSS and hydrogen peroxide, and use brush to remove solidified or sticky mucus. Rinse using the second basin with plain NSS only. Discard gloves and put on another gloves if necessary. Dry the inner cannula using sterile gauze or pad. Gently reinsert it back to the tracheostomy tube. Be sure it is properly locked. Number 16, deep cotton tip applicator or gauze sponge in cup or basin with sterile saline and clean stoma under faceplate. Use each applicator or sponge only once, moving from stoma side outward. Number 17, pat skin gently with dry 4x4 gauze sponge. Number 18, slide commercially prepared tracheostomy dressing or pre-folded non-cotton filled 4x4 inch dressing under the faceplate. Number 9, check the fit of the tracheostomy collar. You should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck, comfortably. Reapply oxygen source if necessary. Number 20, remove gloves, assist patient to a comfortable position, raise the bed rail, and place the bed in the lowest position. Number 21, remove additional PPE if used, perform hand hygiene, and document. Number 22, reassess patient's respiratory status, including respiratory rate, effort, oxygen saturation, and lung sounds.